Welcome back to The New Health, and with us again today is Dr. Cheng Ruan from the Texas Center for Lifestyle Medicine. Welcome back, Dr. Ruan.
Thanks so much. Appreciate you having me.
So today I would love to talk about the L word, longevity, about how healthcare started with longevity, but I know you speak so much more eloquently about this than I do, so I would love to hear your thoughts.
Yeah, thanks for that. So, when we look at longevity, people think, it's how long humans live, but it's far more than that. It's how many generations can we survive, right? So there's longevity, there's fertility, there's relationships, right? And so when we look at longevity, we have to think about what are the biggest risk factors that are affecting humans. Is it cancer? Is it heart disease? Is it diabetes? Could be, but we're reducing human longevity to diseases. But let's take a look at the bigger picture. It's a lot of factors in loneliness and isolation, not feeling supported, and also there's technology that's affecting longevity as well, and fertility. We know that screen time decreases sperm count, for example, right? We know that a lot of late night exposure to internet and stuff like that creates this perseverating thought, and then you can't sleep at night. Well, that also goes against longevity. So if you look at all the really good research that's done on longevity, all really, really good research, okay? The biggest factors rest in sleep. If things are taken away sleep, then longevity will be compromised. If things are taken away sleep, fertility and generational inheritance of life will be compromised as well. So that's where I really want to start with longevity.
That's great. And the thing that I think of just working in fertility myself when it comes to sleep is when we're sleeping and getting quality sleep is when we make those sex hormones that we need in order to get pregnant. So it's not just the data of sleep impacts longevity or impacts fertility. There's real science here. There are real chemicals in our body that we are requiring in order to conceive.
Great. Let's talk about hormones for a second.
Great.
So whenever we're looking at hormones, there's a big misconception of hormones. When people are like, hey, test my hormones, am I deficient in anything, right? The first thing I think about is, how's your sleep? If you are sleeping 8 hours a night, 7.5, 8 hours a night, really good quality sleep, don't wake up at nighttime, and you get your hormones checked at the end of the 7 days, versus you had a stressful week, your hormones will look completely different on the labs, like not even remotely the same. Okay, doesn't matter if you're male or female. Like your hormones will just look completely different. And so a lot of people think about hormones as something that's separate or there's imbalances, but hormones are the innocent bystanders of medicine. What? It's like, and guess what? The hormones actually affect our longevity. So, for example, in men and women, like low testosterone is a big issue. But what causes low testosterone? Well, testosterone mostly is activated, the entire system is activated in stage 3B of sleep, which is the deep sleep state, right? And if you're not getting into there, then that's an issue. Well, you have to go to 3 cycles of deep sleep to activate testosterone and progesterone, and a woman estradiol and estrogen, right? So each cycle is between 2 and 2.5 hours. Which means that 3 cycles is at least 6 hours of uninterrupted deep sleep, okay? So if you are snoring or have sleep apnea, you're not getting into those cycles. And we know that sleep apnea is the number 1 risk factor that is in pretty much all the chronic illnesses and chronic diseases, right? Whether it's coronavirus or just all viruses, whether it's cancer, whether it's hypertension, diabetes, right? And so anything that corrupts the sleep, it really affects longevity. It's the one area where it's the most ignored area for most people, but it's one area that's the most modifiable as well.
That's really incredible that it takes 3 full cycles that are 2 to 2.5 hours long each in order for us to generate or activate enough of our hormones for fertility. But it's not just fertility. I mean, let's talk about low testosterone for a minute. Let's low hormones in women, early menopause, as you had mentioned before.
Yeah. So if you think about it, then the completing of the 3 cycles of sleep has a huge hormonal pathway, but not only that, it actually activates different neurochemicals in the brain. One of them is BDNF, brain-derived neurotrophic factor. And so sleep preserves the brain. It preserves mental health and brain health and neurodegenerative diseases, right? And not only that, like if we think about it, like what happens when people start taking hormones? Well, they start taking hormones and they can feel better sleep and biogenic hormones, et cetera, which I'm a big supporter of. But what happens is if you start taking these hormones and nothing changes, well, there's something else is going on and you have to uncover it. Is it sleep apnea, which commonly it really is? Is it a lot of grinding? There's a lot of tension and anxiety, right? Does your house have some mold or water damage? The environmental factors that are there. In Houston, we have this thing that blows over every few months called the African dust storm, where everyone goes a little bit nuts during that time. The mental health is affected. They have insomnia, right? And depending on the environment, depending on the people that you're around with, like that's what creates this conundrum when it comes to sleep. I think we're heading towards the way of getting better sleep, but people have to understand that people are trying to like have 2 jobs, 3 jobs sometimes, night shift workers, there's got to be a balance there, I think.
So we're talking about sleep with longevity.
Yeah.
And so what else are we thinking about when we're thinking about longevity?
Yeah, another big one with longevity is how proximal we are with the people that are around. So proximal means distance in terms of physical distance, and proximal also means connections. And so humans are made to be in tribes, right? And if you look at the blue zones of the earth with the highest amount of people aged 100 or over called centenarians, the blue zones of the earth all have amazing communities that combine together, okay? It's really interesting because some of these blue zones, there's heavy smokers and heavy drinkers there, and they're like 97, 100 years old, right? Mm-hmm. But they have an impeccable community. So something about being proximal to the people that we love and cherish activates these genes, all right? And these genes promote longevity and cellular health and division. And it activates growth hormone. Growth hormone also gets produced in deep sleep, in that 3rd cycle of deep sleep, as well as stem cells. Stem cells will upregulate in that 3rd cycle of deep sleep, and it'll start doing the repair function. So the miraculous mechanisms of repair mechanisms is actually locked inside the sleep cycles. And all these different things combine together to make a human be more fertile, right? Be more purposeful in living and have impeccable communities. So the way I always look at longevity is like for me personally, how do I show up? If I show up to an event, if I show up to my work, if I show up to family, every action that I do, I'm not competing against myself. I'm competing against myself 160 years from now, okay? So a lot of what I think about is multi-generational legacy with my children and stuff like that. That's true longevity. That is true longevity, our kids, right? And what are the things I'm going to impart on my kids to promote their longevity? So that's always the things I'm thinking about. And I think that when we just think longevity as ourselves and how long we live, we're missing the big picture of multi-generational spread of love and resistance and resilience.
So longevity in this instance, it also makes me think of when you're talking about with your daughters, with generations, is legacy.
Yeah.
So much we think legacy is what are we leaving behind when it comes to finances or things that we own, as opposed to vibrancy of life, which we can teach our children, and then our children will teach their children.
Yeah, absolutely. And there's studies done on this, like there's a lot of people with depression that are in this higher socioeconomic class, right? Mm-hmm. There's actually, I don't know quite the numbers, but there's actually a threshold of if your household income is above this, your mental health just declines, big time. And it's not really just about the material things. Like the material things are great, like, don't get me wrong. But we have to look at relationships as the number one component of things that make us live longer and longevity. And I say that is because I used to do palliative care and hospice. And so when I talk to people, we're bringing them and their families together to serve the patient, right? Sometimes, I had to call, when I was in New York, I had to call someone that was in prison that mama hadn't seen in 24 years and talk to her on the phone. and the patient has been nonverbal. Nonverbal means they can't speak for about 3 months after having a stroke. All of a sudden, gets on the phone with the son, brrr, starts talking Spanish. She's Puerto Rican, right? I don't know what she's saying, but I'm just happy that she's talking, right? And so think about someone who we thought couldn't speak after a stroke, all of a sudden connected with her son that has been in prison, right? And she got to talk to her, and she passed away the next day. But wow, what a beautiful moment I got to witness, right? At the end of life, all that really matters is our connections and relationships, and that's true for every generation.
And so we talked a bit about sleep today. We talked about community proximity and relationships, and it seems to be like we have a running theme, and there seems to be really a lot to it. And we're demonstrating that with the blue zones, as you had talked about. So if we were to say, if there are 5 longevity areas, just briefly, if you could say, what 5 longevity areas would we be focusing on if we're keeping track?
Yeah, absolutely. Number 1 is taking into account how you're showing up. Like, what mood are you showing up in different situations, right? And if you're not showing up in the state in which you desire, you got to work on that, okay? And talk about risk factor for longevity. That is probably the biggest risk factor that's right there, okay? Number 2, take a look at your sleep. I would recommend tracking your sleep. Sleep trackers is really cool, amazing devices, the Oura Ring and stuff like that. That's really good. The Woot, these are great sleep trackers. These are good metrics to look at if you're a data person, okay? Number 3, hydration. Most people are walking around dehydrated, but hydration is actually pretty key because it allows our brain to flow with cerebral spinal fluid. We can make serotonin. Serotonin turns into melatonin at nighttime. Melatonin turns on that switch to make stem cells in that 3rd cycle of sleep. So your stem cells are repairing mechanisms that are there, right? Number 4, the food that you eat. Now, I say the food that you eat, not what you eat, but how you eat it. If you have the healthiest diet in the world, and you're grabbing a shake and putting it into the van and dropping your kids off and sipping on that shake, you're gonna develop immune reactions to that shake no matter what's in the shake, okay? You have to be present when you eat. Eat around the family members, right? And this is why I'm not huge on like fad diets. I'm more interested in how people are presenting before they eat. We even do food meditation sessions at our facility at Texas Center for Lifestyle Medicine, right? And number 5, the most important is have a journal of 3 things that you do for yourself per week, just yourself. So in my doctor's group at the Physician Transformation Institute, which is my nonprofit that raises funds for physicians with mental health concerns, we actually tell the doctors to, you're so good putting your patients on your schedule, put your own name on your schedule. Like put a block there, right? Scheduling time for yourself in that 15-minute block, ideally 30-minute block, doctors, right? And then do nothing.
White space in your calendar.
Exactly,
Well, thank you so much, Dr. Ruan, for coming back with us. Please tell our audience how they can find you.
Yeah, so you can find me on Instagram, Cheng Ruan MD, just search my name, and LinkedIn if you're a business owner, especially in healthcare professionals. And then you can also find my practice website, which is Texas Center for Lifestyle Medicine.org. And for physicians is the physiciantransformationinstitute.com.
Thank you so much, Dr. Ruan.
Thank you.
Thank you for being with us at the New Health this week, and we will see you next week when we come back with Dr. Ruan once again. Have a wonderful week.
This has been a Now Media Networks feature presentation. All rights reserved.